Let's talk about what every man should know about testicular cancer. So testicular cancer is the most common cancer in men aged 20 to 40 years old. Now, that being said, the lifetime risk of testicular cancer is 0.4%, meaning that 4 out of 1,000 men will get a testicular cancer in their lifetime. And that's not very high, but men aged 20 to 40 don't get many other types of cancers either. So what are the risk factors for testicular cancer? Those include a personal or a family history of male infertility, a personal or a family history of an undescended testicle, meaning a testicle that did not make its way all the way to the scrotum, especially if that was not treated before puberty, and obviously a personal history of a prior testicular cancer increases the risk of developing another testicular cancer, but that's quite rare. So if you don't have any of those risk factors, your lifetime risk of getting testicular cancer is closer to 0.2% or even less. So not something that you need to be overly concerned about, but still possible. So what should you do to screen for testicular cancer? There's no real blood test that's commonly used. It's just a testicular self-exam. So every time you get in the shower, just feel the testicle for any obvious lumps or bumps. Now, you don't have to do a very thorough exam and feel every square centimeter of your testicle every single time you take a shower. Testicular cancer really is not often that subtle. It typically presents as a pretty obvious lump or mass that is growing. The other thing to be aware of is that testicular cancer has a very good prognosis, meaning that well over 95% of men who are diagnosed with testicular cancer don't die from it. And that number is really closer to 99%, especially if it's caught early. Most of the time, people who die from testicular cancer are people who have a large growing mass in their testicle and they're ignoring it and hoping that it goes away. And by the time they come to the hospital, they have a orange or watermelon-sized mass that's spread into their lungs and their brain. And even then, it can still be cured sometimes with chemotherapy. So it's not really this very subtle mass that you really need to look for very closely, and if you miss it, you're gonna die. It's more something that's pretty obvious, and if it is there and you get to see a urologist or just go to an emergency room in a relatively reasonable time, you're almost certainly not going to die from it. So if you do feel a lump there that you think is abnormal, you should just have a doctor check it out. And most of the time, the patient is just feeling their normal anatomy and they're just not used to examining themselves. But if there's anything concerning, the next step is typically to just get an ultrasound, which is a non-invasive test. There's no radiation. It's very inexpensive. It's not painful. They just look closely to see if there's any actual mass there that has its own blood flow. And if there is a mass there that's concerning, then we typically do blood work. We often will get CT scans, and if everything is sounding like testicular cancer, then you need to undergo a treatment. But by that point, you're already plugged in with your urologist and you're talking to them about the specifics. So for most men, you're never going to get there. You just do your testicular self-exam every time you get in the shower. If there's nothing blatantly obvious, then don't worry about testicular cancer.